think it's because of there is the immune modulatory function of the azithromycin, and combined with the chloroquine. We know that chloroquine have some functions like increasing the endosomal pH to combat the virus. So about the inflammatory factor, the most important one is interleukin-6. If the patients have a very obviously elevated interleukin-6, we can use tocilizumab. It can be used only one time, and after we use it 2 to 3 days, we can see that the interleukin-6, the level of interleukin-6 decreased very obviously, and the fever and the clinical manifestation get improved. And there is other drugs like the acetylcysteine to make the sputum easier to cough, to lyse the sputum. That's it is because in the pathology result of the biopsy, we can see that there's a lot of mucum in the alveoli. So we use the acetylcysteine to lyse it, to improve the respiratory function of the patients. And in some patients with impact immune function, we can observe that the virus consistently positive in those patients. So we can use the thymosin. You can use the thymosin to modulate the immune system, and when we use it, the dosage will be like the frequency will be like 1 to 2 times a day, and we use it for continually 1 week, and after 4 to 5 days, we can found that the patient's nucleic acid test converted to negative. And there is another therapy is convalescent plasma transfusion. In Wuhan, in our hospital, Wuhan, the Tongji Hospital, they used the convalescent plasma on 46 patients. In our department in Wuhan, we use that on eight cases, and the effect, the outcome of the patient is very promising, and the convalescent plasma can decrease the titer of the virus, and the result is very good. And we also can use CVVH or artificial liver, such kind to eliminate the cytokine storm in the body. And in conclusion, there are five kinds of drugs we can use to treat the COVID-19. First is antivirus, including Abidol, the lopinavir, ritonavir, and chloroquine. The second is antibiotic and the acetylcysteine to lyse the sputum. And the third kind of drug is to block the cytokine storm, the cortisone, and the tocilizumab. The fourth kind of drug is the uh, thymosin to modulate the immune system. And the fifth is convalescent plasma. Thank you.
Thank you very much. And in the end, we want to introduce some traditional Chinese medical science and the traditional Chinese medicine in the treatment for coronavirus, which you may be interested in. After this presentation, we will start the question and answer session. So please get your questions ready, and you can send the one to the group chat now. And please get your camera ready. And Dr. He will give